Good morning, ladies and gentlemen. As was previously said, my presentation is about simulation in surgical, perioperative nursing, education and training. The aim of this review is to highlight the effectiveness of simulation in surgical and perioperative nursing, education and training. It was a systematic review with some inclusion and exclusion criteria, and some of the results that are very interesting and that I'm going to proceed is that simulated practice learning has been used as an adjunct to clinical skills gained in practice settings for a number of years. Life-size mannequins were first used to support learning in 1911, becoming more popular in 1950s. Today, simulation encompasses a range of delivery methods, such as interactive mannequins with lifelike qualities, case studies, and virtual online environments. The appeal of simulation is rooted in its capacity to offer learners exposure to real-life scenarios in a safer environment. Learners can practice skills, receive feedback from facilitators, fellow students, and with the use of high-fidelity simulators can also learn from patient response and outcomes. Then, simulation may be used in clinical environments by the staff or nurses, surgeons, or anesthesiologists, or in educational environments for training our students. In clinical environment, the principle behind simulation training is the recognition that the cause of undesirable outcomes is often poor team performance, rather than a lack of expertise. And simulation is very useful for the evaluation method for care, and also for enhancing and evaluating critical thinking, problem solving, and team leading for all levels of staff. In our educational environment, nursing faculties are often challenged to prepare nurses for complex environments and work with interdisciplinary teams. Simulation be the missing piece that can be added to a strong curriculum that is otherwise working well. Traditionally, nurses have learned and practiced in real clinical settings, which includes making mistakes on real patients. Nurses who learn only by what happens in the real clinical setting may not experience everything they need to learn. It's a phenomenon that is known as education by random opportunity. So a simulated environment lets nurses learn, grow, be challenged, and even make mistakes without the possibility of patient harm. Simulation may be used to teach theory, assessment, application, and integration of knowledge and skills in surgical nursing, and allows learners to function in an environment that is as close as possible to an actual clinical situation. Simulation scenarios can be created from basic common experience or from rare experiences that few nurses ever see. Simulating the rare experiences prepares nurses for the time that these situations actually occur. A simulation session can be video recorded and played back later, a debriefing session, to show participants behaviors that they may have been unaware of during the simulation. This video can then be used in debriefing and critiqued by the individual intern and instructor or the entire class, promoting teamwork and collaboration. These are some of our OR nursing procedures that can be simulated. It's how to put on a gown or gloves, how to scrub the hands, set up a table, count the instruments, putting the drapes, hand the instruments to the doctor using universal protocols such as fire risk assessment or timeout. In 2011, in a National Congress of AORN, a perioperative nursing internship program about simulation was presented, and this is where you can find to see it. In Greece, there isn't any simulation training program about procedures in OR, either in a clinical setting or in a nursing educational institutions. Only basic nursing techniques or processes are done with mannequins without simulating real conditions. while some other countries have developed national nursing educational simulation frameworks to support the whole idea. What are the challenges of simulation? It's the increased cost. Also, clinical practice seen as more than just clinical techniques, and one criticism of simulated learning is that it may only reproduce procedural training. Other challenges are the reports that some students do not find scenario lifelike, and consequently they are unable to relay the skills to the real clinical environment. The type of simulation used in undergraduate nurse education programs varies considerably, and as identified within the literature, is also used in varying situations depending on the degree of reality to be replicated. Although simulation can never replace actual clinical practice, it's a useful tool for creating realism before performing hands-on skills during patient care, and it is a viable supplement or substitute for practice with live patients. As a conclusion, we can say that simulation clearly offers enormous potential for safely developing expertise in clinical skills. In order to be effective, however, such activity needs to be part of a broader picture, supporting and linking with actual clinical practice and having a solid theoretical foundation. It is important that nurse education recognizes that skills laboratory simulation can only provide part of that learning experience. It should never replace time spent with patients, but be an addition to clinical placement experience. Thank you very much.
Any questions? Okay, let me ask you just one question then.
Okay.
You mentioned that simulation nursing education is integrated in national program. Do you recall where?
In which countries?
Yeah.
There are some European countries and in USA as well, but not here in Greece.
Okay, thank you.
Thank you.
As I said,